Good afternoon, good morning, good evening, any part of the world you are listening to me. I still remain Dr. Kwame Eric Olobenga Eniola. Actually, in the line of our the course outline that I drew in the process of this training. Today episode we are going to look at ovariances and fibroid. But we are going to look at ovariances first before we move to fibroid. Ovariances is minor. It's not as terrible as fibroid. Actually, ovariances also cause some pelvic pain during sexual intercourse. It has some symptoms as well that you think it is fibroid, but it's not fibroid. And actually, ovariances automatically do go off with some time. It goes off, especially in the aging women. It goes off, it just go away. It shrink off, and that's the end of it. Then, what is ovariances? You might find ovarian is a fluid sac that develop on an ovary. They are common and do usually cause any symptom. It don't usually cause any symptom per se. They occur naturally in most cases and go away in a few months without needing any treatment. That is ovariances for you. You understand? It creates a form of little or no discomfort to women. It's harmless. But if it ruptures, this can cause serious symptoms. That is, if it ruptures, that is, if it's ruptured without shrinking, it can cause serious symptoms. Now, does a woman with ovariances can he conceive? The answer is yes. The woman can conceive. The woman can be pregnant. A woman can conceive. He can carry pregnancy. That's why he has ovariances. You understand? But some of the symptoms we have to see in case of ovariances, you have a pelvic pain during sex, difficulty in emptying your bowel, and a frequent urinating. You understand? Every period at times, it's not in all cases. You understand? Bloating and swollen tummy. Now, those are the symptoms you see when somebody is having ovariances. Ovariances is harmless, but it is not good for it to be ruptured. But if you ruptured, you are going to see some symptoms. You have to see some serious symptoms. You understand? That's the case of ovariances. Now, let me now go to main proper, that's fibroid. What is fibroid? A non-cancerous growth that develop in or around the womb. Look at the word. And non-cancerous. It's not cancerous, but it develops within the womb and around the womb. You understand? The growth are made up of muscle and fibrous tissue and varies in sizes. What is the main cause of fibroid? It's genetic change. That is scientifically proved that the main cause of fibroid is genetic change that differ from those in typical uterine muscle cell. Hormones and progesterone, two hormones that stimulate development of uterine lining during each menstrual cycle, is preparation for pregnancy, appear to promote the growth of fibroid. That is to say that every woman has tendency of having fibroid because the two hormone, you understand, that stimulate development of uterine lining, they are responsible for promoting the growth of fibroid. What are the two hormones? Is estrogen and progesterone. Progesterone. Those are the two fundamental, and they are responsible for a woman to conceive. That is to say that when somebody is having fibroid, the person should try as much as possible to see how he can take the fibroid out of the system, because the fibroid will actually grow the way pregnancy do grow as well. What are the symptoms you can observe when somebody is fibroid? Heavy vaginal bleeding. The patient will be bleeding heavily. Every month menstruation will be so heavy that at times you will think the patient is having anemia, having shortness of blood. 2, pelvic discomfort. You will not be very okay, you will not be comfortable at the down abdomen part of our body. You understand? The bladder was always full. There will be bladder problem. You will go frequent urination. There will be a low back pain. Erectile pressure, discomfort or pain with sexual intercourse. When those people is having sexual intercourse, it will be here. It will not be enjoyment any longer. You will be feeling severe pain. Can fibroid go away without using any medicine? The answer is rare. Maybe 10% of it can go, shrink and go away. That's 10%, and that happens to people of menopause age, women that are going to menopause. Therefore, the estrogen is no longer working. You understand? The progesterone is no longer working. Therefore, that fibroid cannot develop. It will shrink. But for those people within the age of reproduction, the answer is no. You understand? And the question, can fibroid stop pregnancy? The answer is yes. It all depends on the location the fibroid is. If the fibroid is in the womb, it will stop pregnancy, except it's outside the womb. You understand? And the bigger it is, the bigger the problem. If it's big, it will prevent egg from fertilize, or it will prevent fertilized egg from itself in a lining of womb, and prevent sperm reading the meeting egg, meeting the egg. A fertilized egg from aligning on the womb. Therefore, it is very important for us to know that fibroid do cause infertility. Any fibroid that is greater than 4 centimeter can prevent fertility. There is pattern of taking care of fibroid. We medicals, we have the way of trying to treat our fibroid without going through surgical. People go to surgical. We, with the special grace of God, because of the knowledge of herb, we know there's only we will treat our patient within 3 months. It does depend on the size of the fibroid. The fibroid will shrink and melt away, and the patient will not go through surgery, and they won't have a risk of having problem with our womb. Therefore, in this episode, I will now bring out the practical, what and what we need to use. But before I go to the practical, let me give you the solution. But I will only give one. Therefore, you also go and do the research. You understand? Now, if you want to treat fibroid, get coconut that is already pure. You understand? Look for black soap. Wrap the coconut with the entire soap, that you will not see the coconut again. The black soap will wrap the entire soap, and now put in the pot and burn. When you burn, you powder it. After you powder it, put it in gin. Hello? Don't use fake gin. Use Lord. Put in Lord. Tell the patient to take 2 shots in the morning before food, and 2 shots at night after food. My brother, within 3 months, it's not depending on the size, the fibroid will shrink and melt away. Therefore, in the next video, I will now display how you can prepare such methodology, and I will now tell you the inserter you are going to use that will clear ovarian cysts out of your body. I will teach you that in practical in the next video. Thank you, and God bless you. I appreciate you listening to me. God Almighty will be with us, and will do well by God's grace. Thank you. You are welcome.